Hello, this is Amanda Sampson, and today we are going to evaluate if or if not a plant-based diet can help with depression and anxiety control. And here we have a picture of a plant-based diet. We have cucumbers, tomatoes, and lettuce. And for this PowerPoint, I included three primary articles to help evaluate this research question. Um, our first article, article number 1, is titled right here, A Brief Diet Intervention Can Reduce Symptoms of Depression in Young Adults. And this was a randomized controlled trial back in 2019. The central goal of this study was aimed to assess the effect that a plant-based diet intervention has on the depression levels of a group of young adults. And the outcome of this study was that the diet group, which was the group that was assigned a plant-based diet, they self-reported that they experienced lower levels of depression symptoms than the control group. The control group did not, they were not assigned a plant-based diet. And what is a plant-based diet? A plant-based diet refers to an eating pattern that is oriented around foods derived from plants. Although fruits and vegetables are the core foundation of this diet, it also includes nuts, seeds, oils, whole grains, legumes, and beans. And here is a clip art picture of a plant-based diet, plant-based foods, broccoli, lettuce, avocado, tomato, peppers, salad, and yeah, and kiwi. And for my article number 2, which was titled Traditional Brazilian Diet and Extra Virgin Olive Oil Reduce Symptoms of Anxiety and Depression in Individuals with Severe Obesity. This was a randomized clinical trial. And the central goal of this study was it was aimed to assess the effect that a Brazilian diet and extra virgin olive oil has on the depression levels of a group of young adults. A Brazilian diet consists of fruit, vegetables, fish, and lean meat. And the outcome of this study was that the intervention groups were effective in reducing symptoms of anxiety and depression in severe obese adults. And the way that this was evaluated was the hospital anxiety and depression scale was used to assess and evaluate the symptoms of the participating adults. So Brazilian diet led to reduced anxiety and depression symptoms in these adults. And here are some more pictures of a plant-based diet. And for the last article, this is actually an animal study, and the animal would be mice. And this study is titled Effect of Dietary Fat Type on Anxiety-like and Depression-like Behavior in Mice, 2013. And the central goal of the study was it was aimed to assess the effect that fat has on the depression and anxiety levels of mice that were experimented on. And fat can be derived from many plants. And the outcome of this study was the group that was fed soybean and fish oils had reduced symptoms of depression and anxiety compared to the group that was fed lard. And soybean is considered plant-based. Fish oils, not so much, but soybean, yes. And that is the end of the PowerPoint. However, I have these articles pulled up to help better your understanding of the information. So the first article, A Brief Diet Intervention Can Reduce Symptoms of Depression in Young Adults, which was our randomized controlled trial. We have some pictures to help depict this. So this is a depression scale. And the dark gray represents the baseline. So what the groups started at, their depression levels, what the depression levels of these groups started at. And the light gray is after 3 weeks of this diet change, and you can see that their depression levels reduced significantly after 3 weeks of this plant-based diet change versus a habitual diet. Nothing happened. No, there was no reduction in depression levels or symptoms. In fact, it looked like it even increased a little bit. Um, and same thing here, and that was after 3 months. This third bar right here. It's still, even though it increased a little bit, it's still significantly reduced compared to the baseline, or dark gray. In the Brazilian diet study, um, an extra virgin olive oil study, which was our randomized clinical trial, I highlighted this actually because this shows in numbers. There are no graphs to evaluate this,